Intracytoplasmic sperm injection, or ICSI, as I said, revolutionized the treatment of sperm factor infertility to the point where the scientists got better and better. The fertilization rates are about 60%, meaning if the scientist injects one sperm into each of 10 eggs, on average about 6 out of 10 will fertilize, so that the urologist can actually do surgery on the husband or the male partner and get sperm out of the testis if it's not enough or there isn't a way for the sperm to be ejaculated. They also noticed that sperm factor infertility, those patients often had a higher pregnancy rate ultimately than, say, women doing IVF just for blocked tubes. And so there were, as the scientist is looking at this but still noticing the whole picture, you're interested in sperm, you're not interested in tubes. But if the ladies are the same age, because pregnancy rates with IVF are related to how good the laboratory is that you're going to, how old the woman is that made the egg, and how many embryos are transferred. What if all those variables are equal? The pregnancy rate should be the same. And the scientists noticed that women of the same age getting 1 or 2 embryos back with blocked tubes had a slightly lower pregnancy rate than women of the same age getting 1 or 2 embryos back that the sperm was the problem, and that didn't make sense to them. The hypothesis why the sperm factor women were getting a higher pregnancy rate is because of the manipulation of that shell around their embryo to get the sperm in, made a weak area in that shell, so when it was time for the embryo to hatch out, it had a natural place that was already weaker. So then the light bulb, oh, this could be another advance to get the pregnancy rates better for other women. Maybe the women with blocked tubes that weren't getting that hole or that defect made in their eggshell, what if we just did it on purpose and pretended like we were doing something to help the sperm? Maybe we could get the implantation rates of the embryos better. And that technique is called assisted hatching. And that's something that many IVF programs use routinely to improve, once you make these beautiful embryos, help them implant and attach. So I told you in the very beginning, one of the major advances in vitro fertilization was numbers. More follicles, more eggs, more embryos. We also, by doing the numbers and wanting to get the IVF cycles to work, obviously put more than one embryo into women. And so the in vitro fertilization patients were also getting twins or triplets, like the ladies just taking the drugs for the induction of ovulation. But because of that, we started to decrease the number of embryos we were putting into women's uteruses. We still wanted a lot of eggs, though, because there's a selection. You don't want to just give someone an embryo. Maybe you wanted 5 embryos because you wanted to pick the best one that would make a baby. But you still had leftover embryos. So immediately, because we had all these leftover embryos in the laboratory now, and we didn't want to just discard them, the scientists went to the drawing board and tried to make embryo freezing more and more efficient. As embryo freezing got more and more efficient, and the laboratory culture systems and the skill of the embryologist got better and better with time, over the last 2 decades, we've been able to decrease the number of embryos that we put into the uterus dramatically. And now, especially in women under 35, the techniques and the embryo development are so good that we can often put a single embryo back into the uterus and get a pregnancy. But there are people that aren't infertile yet that are ultimately going to become infertile. And that gets to be the consultations that infertility doctors started to have with oncology patients. Before I came here, I was part of the Cornell team years ago, kitty corner across the street from Memorial Sloan Kettering, and young women would come that were going to, say, get chemotherapy or radiation for a cancer and want to somehow preserve their fertility in the future. For various biologic reasons, the egg being the largest cell in the human body, the laboratory techniques to freeze and thaw eggs weren't as good as the laboratory techniques to freeze and thaw sperm or embryos. So a young male that had some sort of a cancer, well, he was lucky. He could go to a sperm bank, masturbate as many samples as he could before his chemotherapy or radiation. He lives a good life. He has his problem at 19. He gets married at 29. And his wife can be inseminated with the sperm that he was able to store before his cancer treatment. Young women never had that option. Women can't go to some room and masturbate their eggs out. The only way they can be taken, is we can get them, is them being taken out of their body in an in vitro cycle. But we did start very early on in embryo cryopreservation for women with cancer before their treatment. The problem with embryo freezing is it does necessitate sperm. And the women with cancer who were married were in luck because they could make an embryo with their husband's sperm in their egg and freeze their embryos before their cancer treatment. I had sad follow-up consultations with single women who had come to me from Memorial Hospital that wanted to freeze eggs before their cancer treatment, and I had to explain to them that egg freezing, the pregnancy rates were so dismally low that it wasn't ethically responsible for me to offer something that really didn't work. But I could freeze their embryos if they were willing. If they didn't have a male partner to make an embryo with, they could buy sperm, say, from a sperm bank to make an embryo. But of course, those young women with cancer wanted to freeze their eggs to have a child with the partner of their choice someday, not just an anonymous sperm donor. So the technology lagged behind, but what happened was in March of 2004, the Italian government outlawed embryo cryopreservation, and the Italian physicians and scientists were only allowed to inseminate 1, 2, or 3 eggs, and any fertilized egg must be put into a uterus. Consequently, the Italian physicians and scientists, and one of the most famous is who has most of the babies born from this, Dr. Eleonora Porcu, and her embryologist, Dr. Fabri at the University of Bologna, went back to the drawing board. They were doing these IVF cycles. They had all these leftover eggs that they didn't want to just throw out. And they said, we've got to be able to make egg freezing work. And the egg freezing thawing pregnancy rates were in the single digits. So these two women, the physician and the scientist, went back to the drawing board and doggedly tried to improve the scientific protocols to freeze and thaw eggs. So those pregnancy rates went from the single digits into the low teens, and they started getting into the 20s. So finally, scientists from around the world said, well, we even have better equipment than them. Maybe we can even make egg freezing better. Now, I routinely do consultations with young women with various types of cancer, leukemia, lymphoma, breast cancer tends to be one of the more common ones. And now I can say honestly that egg freezing is so close to embryo cryopreservation pregnancy rates that that's really what I routinely recommend to someone without a partner. There may be a few percentage points higher, and for a married couple, they might still choose to freeze embryos. But what has rapidly evolved is I've seen women, say 34th breast cancer, come and see me, and I talk to them about egg freezing, and then they say, well, you know, I have a 32-year-old sister and she doesn't have a boyfriend yet. If that egg freezing is so good, could she just freeze her eggs even though she doesn't have cancer? Women have gotten educations and enjoyed their careers and their education and that for maybe delayed them socially finding Mr. Right to start their family, whatever. So that's contributed to the increase in infertility of the patients that we see, is because more couples are delaying having children, and that has been a huge detriment. But those older women that delayed having children before egg freezing was invented, or as successful as it was because it's been around actually for a while, those older women who waited till they were 40 because they were concentrating on their education and careers were forced to use anonymous egg donors. But obviously, that's a second choice for that 42-year-old woman. She still really, really would like her own genetic biologic child. In women's early 30s, there are going to be, as time goes on, more and more women thinking of if they're not ready to have children at 32, or they don't have a partner that they want to have a child with at 32, they may want to freeze their eggs so that they can use their own eggs to have a baby when they're 42 as opposed to someone else's. And that only, again, becomes ethically possible to recommend to someone to consider if the pregnancy rates are good enough. And that's sort of like where we are now with the pregnancy rates as this technology has just grown and mushroomed over the years, as we borrow from this and go back and forth to the exciting things for the next generation, having options that women in my generation didn't. So I just feel extremely privileged to be working in such an exponentially growing field of medicine, and I sort of came in on the ground floor when it was very new, and so I've been able to see these developments myself over time as opposed to just read about them in a textbook, and it really means a lot to me. I feel very privileged to be in this field of medicine. It's just really fascinating to me, and I love coming to work every day, and I just feel privileged to be able to for all the women that and couples that I've helped over the years, and it's only going to get better and better for our next generations of children and patients.